Today we're going to discuss communicating with the person, which is Chapter 7 in your textbook. Communication is the exchange of information. A message sent is received and correctly interpreted by the intended person. The three components of communication are the message, the sender, and the receiver. Factors that influence communication are basic needs, culture and religion, illness and disability, and family. In healthcare, good communication is necessary to help a patient reach his or her optimal level of function. The optimal level of function is the person's highest potential for mental and physical performance. Listening is a part of communication. Listening involves hearing the message, showing an interest in the message, not interrupting the person speaking, asking appropriate questions for clarification, being patient and allowing the resident time to respond, reducing or eliminating distractions, and using silence appropriately. When communicating, an understanding of the whole person is important. Holism is a concept that considers the whole person. The whole person has physical, social, psychological, and spiritual parts. These parts are woven together and cannot be separated. You must know and address the whole person for effective quality care. Greet the person by title, Mrs. Jones, Mr. Wills. Then ask what name the person prefers. Do not use first names or any other name unless they ask you to. A need is something necessary for maintaining life and mental well-being. Abraham Maslow is a psychologist who stated that basic needs must be met for a person to survive and function. He created a hierarchy of needs. In the hierarchy, the needs are arranged from the lowest level to the highest level. Lower level needs must be met before higher level needs. Disease, injury, or advanced age may prevent people from meeting their own needs. This is a pyramid that shows Maslow's hierarchy of needs. At the bottom is physical needs, such as oxygen, food, water, elimination, rest, and shelter. The nurse aide helps the client meet these needs by encouraging eating, drinking, and adequate rest, and assisting with toileting if necessary. Next are safety and security needs. The person needs to feel safe from harm, danger, and fear. For each task, the person should know why it is needed, who will do it, how it will be done, and what sensations or feelings to expect. Health and financial security are examples of safety and security needs. The nurse aide helps a patient meet these needs by listening, being compassionate, and being caring. Next, we have love and belonging needs. These needs relate to love, closeness, affection, and meaningful relationships with others. Friendship, trust, and acceptance are examples of love and belonging needs. The nurse aide helps the patient meet these needs by welcoming them to the facility and encouraging interaction with other clients in the facility. Next, we have self-esteem needs. Esteem is the worth, value, or opinion one has of a person. Self-esteem means to think well of oneself and to see oneself as useful and having value. People often lack self-esteem when ill, injured, older, or disabled. Self-respect is an example of a self-esteem need. The nurse aide helps patients meet this need by encouraging independence, praising the client for successes, and promoting dignity. Finally, at the top of Maslow's pyramid is self-actualization, which means experiencing one's potential. It involves learning, understanding, and creating to the limit of a person's ability. This is the highest need. Rarely, if ever, is it totally met because most people constantly try to learn and understand more. The nurse aide helps the client meet this need by respecting client wishes regarding their activities. It's important that the nurse aide helps promote client independence. Ways to do this are to praise every attempt at independence, overlook failures, express confidence in the patient's abilities, allow the patient time to do things for him or herself, develop patient to wait for the patient to complete tasks, encourage progressive mobility, assist with range of motion, promote social interaction, and encourage activity. Nurse aides must practice person-centered care. It is used to promote patient independence. Person-centered care values each unique person, respects personal preferences, encourages the client to direct his or her care, and helps the client feel at home. Culture and religion are important parts of patient care. Culture is the characteristics of a group of people, the language, values, beliefs, habits, likes, dislikes, and customs. Typically, culture is passed from one generation to the next. Culture represents the ideas, learned beliefs, values, behaviors, and attitudes groups possess. A person's culture influences communication and health practices and beliefs. Culture also affects thinking and behavior when healthcare is needed. National cultures are the various cultures from different parts of the world. Ethnicity is usually by country of origin. Hospitals and nursing centers often offer religious services and have areas for prayer. Religion refers to spiritual beliefs, needs, and practices. So for instance, a Jehovah's Witness will refuse blood transfusions because they believe a human must not sustain life with another person's blood. The person's care team includes cultural and religious practices. The CNA must respect the person's culture and religion. This helps the CNA provide better care. Each person is unique. It is important to remember that a person may not follow all of the beliefs and practices of his or her culture. Cultural sensitivity is the knowledge and interpersonal skills that allow you to understand, appreciate, and embrace individuals from cultures and ethnicities other than your own. It's important to respect clients' beliefs with religious differences. CNAs will encounter people from all different backgrounds and ethnicities. CNAs will encounter people that speak different languages. It's important to provide interpreter services per facility policy. CNAs will encounter people who have specific cultural and religious diets. For instance, residents may not eat certain foods, and family may bring traditional meals. Different cultures require different spatial distances for respect. For instance, some cultures are uncomfortable when you are in their personal space. Some cultures do not allow the interaction of genders, so it's important to approach patients and provide care according to their culture. For instance, if female patients in certain cultures cannot have a male CNA, it is important for the charge nurse to try and assign a female CNA whenever possible. And then finally, generational interactions are going to impact nursing care. Each generation has its own set of values, beliefs, and life experience. It's important for the CNA to take time to learn from others. These are some strategies to provide culturally sensitive care. Always respect the patient. Honor the resident family request to follow cultural guidelines. Provide the resident or family with privacy. Ask the resident family if they have specific ways of celebrating holidays. Ask if the patient has special dietary guidelines. Do not stereotype. And do not engage in gossip about a resident because of his or her cultural preferences. As a CNA, you may care for a variety of different patient populations. For instance, you may care for mothers and newborns, children, adults with medical problems, persons having surgery, persons with mental health disorders, persons needing bariatric care, persons needing rehabilitation, older individuals, and persons needing long-term care. Obstetrics is the field of medicine concerned with the care of women during pregnancy, labor, and childbirth, and for 6 to 8 weeks following the birth. Pediatrics is the field of medicine concerned with growth, development, and the care of children. Psychiatry is the field of medicine concerned with mental health disorders. Bariatrics is the field of medicine focused on the treatment and control of obesity, which is defined as having an excess amount of total body fat or body weight that is 20% or more above what is normal for a person's height and age. Morbid obesity is weighing 100 pounds or more over one's normal weight. Geriatrics is the field of medicine concerned with the problems and diseases of old age and older persons. There are some terms that you may hear when working in long-term care. First is alert and oriented. That is people who know who and where they are. Oftentimes you'll hear someone describe a patient as A and O times 4. The A is alert, the O is oriented, and the times 4 stands for person, place, situation, and time. You might hear the term complete care. Persons who need complete care cannot meet their own needs, and they require total help with all activities of daily living. Short-term residents are recovering from an illness or injury, and the goal is optimal level of functioning and returning home. Persons needing respite care, that is when the person living at home goes to a nursing center for a short stay so that the caregiver can get a break for vacation, business, or rest. Lifelong residents are individuals who require lifelong assistance and support. Persons with mental health disorders may have problems with behavior and function. Self-care and independent living may be impaired. Finally, persons who are terminally ill, the goal is quality end-of-life care because they are dying. Okay, what does effective communication look like? Effective communication is using words that have same meaning for you and the patient, avoiding medical terms, giving facts and being specific, appreciating the person's problems and frustrations, respecting the person's rights, religion, and culture, giving the person time to understand the information provided, and being patient. The types of communication are verbal and nonverbal. Verbal communication uses written or spoken words. When speaking, face the person, control the loudness and tone of voice, speak clearly and slowly, do not use slang, and repeat information as needed. When using written communication, keep writing simple and brief. Use black pen on white paper and print in large letters. Nonverbal communication does not use words. Gestures, facial expressions, posture, body movements, touch, and smells are used. Nonverbal messages more accurately reflect a person's feelings than words do. They are usually involuntary and hard to control. Touch is a form of nonverbal communication. Cultural groups have rules and practices about touch. It is important to maintain professional boundaries. Body language is another form of nonverbal communication. Facial expressions, gestures, posture, hand and body movements, gait, eye contact, and appearance are examples of body language. There are multiple methods of communication. Listening means to focus on verbal and nonverbal communication. You use sight, hearing, touch, and smell. You focus on what the person is saying. You observe nonverbal cues. It is important to face the person, maintain eye contact, and respond to the person. Paraphrasing is restating the person's message in your own words. It shows you are listening, lets the person see if you understand the message, and promotes more communication. Direct questions focus on certain information. For example, do you want to shower this morning? Open-ended questions lead or invite the person to share thoughts, feelings, or ideas. The person controls the topic and the information given. Answers require more than a yes or a no. For example, what do you like about living with your son? Clarifying helps you understand the message. For example, could you say that again? Focusing deals with a certain topic. It is useful when a person rambles or wanders in thought. For example, let's talk about breakfast. Finally, silence is a powerful way to communicate. It gives time to think, organize thoughts, or choose words. Barriers to communication prevent the sending and receiving of messages. If the same language is not used, the message will not be accurately interpreted. People with cultural backgrounds may attach different meanings to verbal and nonverbal communication. Changing the subject when a topic is uncomfortable blocks communication. Opinions involve judging values, behaviors, or feelings. It is important not to make judgments or jump to conclusions. Do not pretend to listen because it shows a lack of interest and caring. Pat answers such as "don't worry" and "everything will be okay" show a lack of caring about a person's feelings. Speech, hearing, vision, cognitive function, and body movements can also be barriers to communication. Finally, values and communication styles vary among age groups. Persons with special needs communicate differently. Persons with disabilities and the person who is comatose. A disability is any lost, absent, or impaired physical or mental function. Comatose means being unable to respond to a stimuli. A stimulus is something that causes the person to change, react, or respond. Often, the comatose person can hear and feel touch and pain. Pain may be shown by grimacing or groaning. Hearing loss also affects communication. Hearing loss is not being able to hear the range of sounds associated with normal hearing. Deafness is hearing loss in which it is impossible for the person to understand speech through hearing alone. Some people may wear hearing aids or lip read. American Sign Language, which is also called ASL, uses signs made with hands and other movements to communicate words. Some people have hearing dogs that alert the person to sound, such as phones, doorbells, and smoke alarms. Phone amplifying devices are special phones receivers that make sounds louder. Sound phones work with hearing aids. The hard of hearing person, the caller, uses a teletypewriter or other device to send a message to the person called. The message back to the hard of hearing person is typed by the relay assistants for the caller to read. This is the telephone and relay services. When communicating with a hearing impaired person, reduce distracting noises, get the resident's attention before speaking, speak clearly and slowly, maintain eye contact, use short, simple words, use picture cards, write if necessary. Some other hearing devices are extension bells that make phones ring louder and smoke alarms with strobe lights. Speech disorders also affect communication. Aphasia is the total or partial loss of the ability to use or understand language. It occurs due to stroke, head injury, brain infection, dementia, or brain tumor. Apraxia of speech is when a person cannot use speech muscles to make words for understandable speech. The person understands and knows what to say, but the motor speech area in the brain is damaged. Apraxia of speech can occur due to stroke, head injury, brain infection, dementia, or brain tumor. Dysarthria occurs when nerve damage affects the mouth and face muscles, which results in slurred, soft, slow, or hoarse speech. Dysarthria often occurs after a stroke or brain injury. Vision disorders can also affect communication. Blindness is the absence of sight. Vision loss can be sudden or gradual. Age-related macular degeneration causes a blind spot in the central area of vision. Central vision is needed to read, write, drive, cook, and see faces for fine detail. Cataracts is the clouding of the lens. A normal lens is clear. A person who has cataracts, when they are trying to see, it is like looking through a waterfall. Cataracts can occur in one or both eyes. Diabetic retinopathy occurs when blood vessels in the retina are damaged. It's a complication of diabetes. Diabetic retinopathy is a leading cause of blindness among working adults. Usually both eyes are affected. Glaucoma occurs when fluid builds up in the eye, causing pressure on the optic nerve. The optic nerve is damaged, which causes vision loss and blindness. Glaucoma can affect one or both eyes. To communicate with the visually impaired resident, identify any assistive devices, such as glasses or special lighting. Knock on the door and introduce yourself when entering the room. Position the resident so they are not looking into bright light or a bright window. Position yourself where the resident can see you. Have adequate light in the room. Encourage the resident to wear glasses. Use the face of the clock to describe the location of items, and only move patient items with permission. Confusion and dementia can also affect communication. Dementia is the loss of cognitive function that interferes with daily life and activities. Dementia is a group of symptoms, not a specific disease. Dementia is not a normal part of aging. It is caused by damage to brain cells. Depression, drug side effects, excessive alcohol use, thyroid problems, and vitamin deficiencies are examples of causes. Alzheimer's disease is the most common type of permanent dementia. Alzheimer's disease is thought to be caused by plaques, protein pieces that build up in the brain in the spaces between nerve cells, or tangles, twisted protein fibers that build up inside brain cells. Residents with cognitive impairment may be extremely anxious or frustrated and unable to communicate needs. How should the CNA communicate with individuals with disabilities or Alzheimer's? When working with hearing impaired individuals, reduce or eliminate background noise. Make sure the person's hearing aid is turned on and working. When working with speech impaired persons, have the person repeat or rephrase statements as necessary. Repeat what the person has said. Have the person point, gesture, or draw key words. Provide a quiet, calm setting. Include the person in the conversation. Listen and give your full attention. Repeat as needed. Speak in a normal tone. When working with people with visual impairments, identify yourself when you enter the room. Ask the person how much he or she can see. Identify others. Offer to help. Leave the person's belongings where you see them. Use the face of the clock to describe the location of items. When working with patients with Alzheimer's, avoid giving orders. Don't demand the truth because they don't remember. For instance, don't ask what is today. Instead, say today is Friday. Don't correct errors. Don't point out errors. Don't give multiple choices. Only give 2 choices. Don't ask open-ended questions. Stick to yes or no questions. Finally, when working with people with cognitive impairments, be sure to have the resident's attention. Explain what you are doing prior to starting care. Allow the resident opportunities to talk. Keep the same routine as much as possible. Be honest and reliable to gain the resident's trust. Know the resident's likes and dislikes. Speak slowly, softly, and simply. Behavioral issues also affect communication. Anger. The causes of anger include fear, pain, and dying and death. Loss of function and lost control over health and life are causes. Anger is a symptom of some diseases that affects thinking and behavior. Verbal outbursts, shouting, raised voices, and rapid speech are common. Some people are silent. Others are not cooperative. Nonverbal signs include rapid movements, pacing, clenched fists, and a red face. With demanding behavior, nothing seems to please the person. The person is critical of others. Loss of independence, loss of health, and loss of control of life are causes. With self-centered behavior, only the person's needs are important. The needs of others are ignored. With aggressive behavior, the person may swear, bite, hit, pinch, scratch, or kick. Fear, anger, pain, and dementia are causes. With withdrawal, the person has little or no contact with others. He or she spends time alone and does not take part in social activities. With inappropriate sexual behavior, people may make inappropriate sexual remarks or touch others in the wrong way. These behaviors may be on purpose or they may be caused by disease, confusion, dementia, or drug side effects. De-escalation is a way to manage behavioral issues. De-escalation involves calming a patient down so that they are able to control their emotions. There are 2 videos here, de-escalation and aggressive behavior, that demonstrate how to manage behavioral issues.